You rested. You stretched. So why does your heel still hurt? If you're a runner dealing with heel pain that just won't go away, you're not alone. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. I see this frustration every day in my practice. Runners come to me saying they took time off from running. They tried new shoes. They bought inserts. They've been stretching religiously, but the pain comes back the moment they start running again. Sometimes it's worse after runs. Sometimes it's that stabbing pain with your first steps in the morning. Here's what most runners don't realize. You're likely treating the symptoms and not the root cause. And that's why your heel pain keeps coming back run after run, week after week. In today's video, I'm going to explain exactly what's happening with your heel pain, why the treatments you've tried aren't working, and most importantly, what you need to do to actually fix the problem so you can get back to running pain-free. But before I do let others know about these videos, please like, comment, hit the subscribe button, and share on social media. This will help other runners find this information. I also wrote a book all about running injuries of the foot and ankle. I'm happy to send you a copy as a gift. Go to www.runninginjurybook.com to request your free copy. Let's start by identifying what kind of heel pain you're actually dealing with, because not all heel pain is the same. The most common diagnosis is plantar fasciitis. This is pain under the heel, right where the thick band of tissue called the plantar fascia connects to your heel bone. The classic symptom is pain that's worse with your first steps in the morning or after you've been sitting for a while. You get up, take a few steps, and it feels like someone's stabbing your heel with a knife. But there are other possible causes that often get missed. You might have Achilles insertional tendinitis, which is pain where your Achilles tendon attaches to the back of your heel bone. There's heel fat pad syndrome, where the cushioning under your heel becomes inflamed. You could have nerve irritations, specifically something called Baxter's nerve entrapment. In rare cases, you might even have a stress fracture in your heel bone. The problem is, most of these conditions get lumped together and treated the same way. But if you don't know exactly what you're dealing with, you can't treat it effectively. Now, here's why your heel pain isn't going away, and this is crucial to understand. First, you're not actually healing. You're just calming it down. When you ice your heel, rest, or take anti-inflammatory medication, you're reducing inflammation temporarily. But here's something most people don't know. Plantar fasciitis, especially chronic plantar fasciitis, is often degenerative, not inflammatory. What does that mean? It means the tissue is actually broken down over time. It's not just inflamed, it's damaged. And you can't heal damaged tissue just by reducing inflammation. Second, you're returning to running too soon. Here's the cycle I see all the time. Pain decreases, so you think you're healed. You start running again. The tissue gets re-injured because it wasn't actually strong enough to handle the load. The pain comes back, often worse than before. That's what I call the tissue re-injury cycle. That's why so many runners get stuck in this pattern for months or even years. Third, your mechanics haven't changed. If you have flat feet, high arches, or other biomechanical issues that contributed to the problem in the first place, those are still there. Tight calves that increase strain on the plantar fascia, still tight. Weak foot muscles that can't support your arch, still weak. You can rest all you want, but if the underlying mechanical problems aren't addressed, your pain will return as soon as you start running again. Fourth, your shoes might actually be part of the problem. I know this sounds counterintuitive, especially if you just bought expensive running shoes. But worn out cushioning, the wrong type of shoe for your gait, or even minimalist shoes that you haven't properly adapted to can all contribute to heel pain. I've had runners tell me they bought the most expensive, most cushioned shoes they can find, thinking this would solve the problem. But sometimes too much cushioning can actually make things worse by making your foot muscles lazy and creating instability. Now let me explain the most important concept for understanding heel pain: load versus capacity. This is simple but crucial. Your foot has a certain capacity. Think of it as how much stress it can handle. Running applies load stress to your tissues. Pain happens when the load exceeds your tissue's capacity to handle it. Most treatments focus on reducing the load temporarily. You rest, you ice, you take time off running, and that can help in the short term. But healing happens when you increase your tissue's capacity to handle load, when you permanently reduce the problematic load. If you only focus on reducing load without increasing capacity, you'll be stuck in that cycle forever. As soon as you return to running, the load will exceed your capacity again and the pain will return. So how do you actually fix heel pain that won't go away? Let me walk you through the steps that actually work. Step 1, reduce load temporarily, but do it smart. This doesn't necessarily mean stopping running completely. You might need to modify your mileage, avoid speed work or hills, and incorporate more cross-training. The key is reducing the problematic load while maintaining your fitness and keeping your tissues active. I've had runners who were doing 40 miles a week cut back to 20 miles a week, but they've added swimming and cycling. They maintain their cardiovascular fitness while giving their feet time to heal. Step 2, improve tissue capacity. This is where most people go wrong. They think stretching alone will fix the problem. Stretching is important, but it's not enough. Calf stretching is critical because tight calves are one of the main risk factors for developing plantar fasciitis. But you need to stretch both the gastrocnemius and the soleus muscles, and you need to do it daily, not occasionally. I'm talking about holding stretches for at least 30 seconds, 3 times each, every single day. But here's what's even more important, strengthening. You need to strengthen both your calf muscles and your foot intrinsic muscles. Building strength takes time, but this is what truly changes your feet and calves to help them heal, become more resilient, improve blood flow, and restore that natural built-in support. No external support, no matter how expensive your orthotics or how cushioned your shoes, will ever be as good as what you were born with, as long as you keep it strong. The kind of shoes most of us wear can compromise the strength of our feet over years and decades. So any heel pain recovery program needs to place heavy emphasis on building strength. Step 3, support the foot during healing. While you're building strength and capacity, you need to support the foot to prevent re-injury. This might mean wearing a more cushioned supportive shoe during daily activities. This might mean using orthotics, either custom made or high quality over-the-counter ones. The key is avoiding barefoot walking on hard surfaces while you're healing. I know this goes against some popular advice, but when your tissues are damaged, they need support when they're rebuilding. Now, when conservative care isn't enough, there are treatments that can accelerate healing. Shockwave therapy uses acoustic waves to stimulate tissue healing and has excellent results for chronic plantar fasciitis. PRP injections use your own blood platelets to encourage real tissue repair, targeting the degeneration in the fascia. I want to mention something important about cortisone injections. While they can provide temporary relief, I generally recommend avoiding over-reliance on cortisone. Yes, it can reduce pain in the short term, but it can potentially weaken tissue over time and doesn't promote actual healing. Instead, consider a regenerative injection known as either platelet-rich plasma, known as PRP, which uses your own blood to heal your injury. You can also use an umbilical cord allograft, an injection from a donated umbilical cord from a healthy live birth, which provides neonatal cells to help heal your injury. Let me talk about some common mistakes runners make that keeps them stuck in the pain cycle. The biggest mistake is running through pain. I hear this all the time. It hurts for the first mile, but then it loosens up and feels fine. That's not a green light to keep running. That's a warning sign. When tissue is damaged, running through pain often makes it worse, even if it feels better temporarily during the run. Another mistake is overstretching aggressively. When tissue is already damaged and inflamed, aggressive stretching can actually irritate it more. Stretching should be gentle and consistent, not forceful. The third mistake is ignoring recovery time. Here's something every runner needs to understand. Healing is slower than fitness loss. You might lose some cardiovascular fitness during recovery, but you can regain that much faster than you can heal damaged tissue. Be patient with the process. So when should you see a specialist? There are some red flags that indicate you need professional help. If your pain has lasted more than 6 to 8 weeks despite rest and basic treatment, that's a sign you need a proper evaluation. If the pain is worsening despite rest, or if it's changing location or character, maybe it started under your heel but now it's moving up into your arch and towards your toes, that needs to be evaluated. A proper evaluation should include biomechanical assessment to identify any mechanical issues contributing to the problem. We might need imaging studies to rule out stress fractures or other structural problems. And most importantly, you should get a personalized treatment plan based on your specific situation. Here's my final takeaway, and this is why heel pain keeps coming back. You didn't fix the cause, you just reduced the symptoms temporarily. Real recovery takes three things: proper load management, strengthening the tissues that support your foot and ankle, and addressing any biomechanical issues. Sometimes it requires advanced treatments like shockwave therapy or PRP. But here's what I want every runner to understand. Heel pain is not something you have to live with. It's not an inevitable part of running. With the right approach, most runners can get back to pain-free running. The key is being patient with the process and addressing the root cause, not just the symptoms. Don't let insurance coverage or cost be the only factors in your decision. Focus on what actually works to solve the problem long term. I've been treating runners for over 25 years, and I've seen countless athletes get back to the sport they love after dealing with chronic heel pain. The treatments exist, the knowledge is there, and with the right approach, you can be running pain-free again. If you're dealing with heel pain that keeps coming back, don't wait for it to get worse. The longer you wait, the longer it takes to heal. Get a proper evaluation, understand what's causing your pain, and commit to a comprehensive treatment plan. How long have you been dealing with heel pain while running? Let me know in the comments below. I read every comment and try to respond the best I can. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Don't forget to order my book all about running injuries. You can order it for free at www.runninginjurybook.com. If you're a runner dealing with persistent heel pain, contact us at the office for a comprehensive evaluation. That link is in the description. Remember, you don't have to choose between running and being pain-free. With the right approach, you can have both. Thanks so much for watching, and have a great day.